Good morning. I've been joined by the Chief Health Officer and Deputy Secretary Kate Matson to provide today's update. Just to alert you all that the Chief Health Officer has AHPPC at 12:30 and the Treasurer and the Minister for Industry will have a separate media conference shortly after this one. So I can report that there were 8 new cases reported today, all locally acquired, all linked, and all quarantining throughout their infectious period. 4 of those cases relate to the Miss Frankie's restaurant at Cremone. 2 were patrons, 1 is a staff member, and 1 is a household contact. A further case is a student at Trinity Grammar. Another case is a household contact linked to St Patrick's Primary School in Murrumbeena. A further one is a household contact for the house in Mildura. And 1 is a household contact linked to Young and Jackson's. I can, however, advise that in the last hour, in terms of immediately before this media conference, we have been advised of a further community case that has been just come into the system. They are not an existing primary close contact, and we do know that symptoms began on Monday evening with the person. They were tested Tuesday, and the positive result has come in this morning. Case interviews are underway to get an understanding of the movements and the interactions of this person. But I can report that the person works at the Moonee Valley Racecourse Drive-Through Testing Centre as a traffic controller, and that prior to their tests on Monday, that they worked at least 2 days whilst infectious. We do believe that there will be minimal risk to those at the site that the testing centre was underway. However, the site has been closed. All the staff who have worked on the same shifts have been sent home to isolate and to be followed up. And our pathology team are identifying, in fact, if there were any positive cases who went through that testing centre during the period in which the person worked. This is very early information. This is literally just dropped into the system. The full case interview is required and further work is underway, but we will have more to say about the progress of that case later in the day through the normal alert process. Having said that, we are also entering into some very busy times for critical clearance of a very large number of primary close contacts who have helped us get through the last 14 days by their isolating at home. And Ms Matson will speak to some of that clearance process in more detail, and indeed the Chief Health Officer will discuss the restrictions being eased. But before I do hand over, what I wanted to do was just to reinforce the importance of, now that we are reopening, just how important the contact tracing team and public health team found the whole issue of data from the QR code systems that we now have in place right across the state. And just to use this as an opportunity to remind all Victorians to check in everywhere, every time, as part of keeping us on this progress to reopening. The day before we went into lockdown a couple of weeks ago, Victoria had its single biggest day for check-ins in terms of its data. 5.6 million check-ins were recorded on the Services Vic app on the 15th of July. That data was just so critical for our contact tracers to do both the 3 rings: the person who was positive, their close contacts and their secondary contacts. That information in real time, readily available so quickly, allowed us to have the situation where throughout the course of the last 2 weeks we had no mystery cases. And on the basis of that, allow us to capture that data, stay up with the spread of the virus, and ultimately get ahead of it to where the position was for the last few days. We had 0 cases in the community, subject to what's happening at Moonee Valley. And what we want to see is that those check-in numbers jump back, indeed exceed those rates, as all Victorians take the important steps that they need to do to keep us open and to keep us on this path. It's so important, and I'm grateful to every customer, to every business, to every venue, to every manager, and to every Victorian who is committed to making sure that this process of checking in everywhere, every time happens. The Services Vic app was really instrumental in making sure that we got not just the data on people, but exposure sites, close contacts, and the delivery. So please, I just use this as an opportunity to reinforce the message: check in everywhere, every time, and of course, please get vaccinated when the opportunity arises, and please get tested every time you have even the most mild of symptoms. I might ask the Chief Health Officer to say a few words, followed by Ms Matson, and then we're happy to take questions. Thanks.
Thanks, Minister. So at 11:59 p.m. last night, lockdown was lifted across Victoria. As I said yesterday, the commitment of every Victorian to staying home and staying safe helped us get to that position, as did the 40,000 primary close contacts and their household members who joined them in 14 days of quarantine. As a reminder for everyone about the changed settings, so there are no restrictions on the reasons to leave home, but staying COVID safe remains very important. There are no restrictions on travelling across the state, but if you're travelling interstate, be aware of 2 things. Other states are likely to have their own controls on entry while we're emerging from our outbreak, so look for updates across any jurisdiction you might be travelling to, and you'll need a permit to return. And then New South Wales as an extreme risk zone means that if you don't live in the border bubble, you won't have an automatic entitlement to return to Victoria if you travel into these areas without an exception, or unless you're a specialised worker and have a permit. So don't travel to an extreme risk zone and don't travel to a red zone. Face masks remain mandatory indoors and out. You do not need to wear a mask in your own home or if a lawful exception applies. Private gatherings in the home are not at this stage permitted. Household settings are where we know coronavirus spreads the most. There was a recent household gathering in Pendle Hill in New South Wales where dozens of people have become cases. There are many more examples of that across the world, and we can't risk that happening here. If you want to see friends and family, you can, but please do so outdoors in a public space, in a group of up to 10 people, or join them at a venue that can operate like a restaurant or a cafe. If you can work or study from home or another suitable premises, you can go to work. Offices can increase in attendance up to 25% capacity or 10 people, whichever is greater, and schools and early childhood care are open. Critically, if you're required to wear a mask at school, you really must. If you're going to the snow this weekend, you should start thinking about when and where you'll get that test, because you need a negative test for everyone in your household who's 12 and over. That may mean getting a test close to home where it's easy and you won't have a wait time, rather than close to the mountain that might be under more pressure. So you've got that 72-hour period before you go up to the mountain to get that test. So look to get one here in Metro Melbourne if you're coming from Melbourne. Testing turnaround times are really good. 99% of tests yesterday were returned by the next day. So you're very, very likely to get that negative result in good time. But stay on the safe side and prepare for it to take a bit longer just in case. I am really pleased that we've been able to lift lockdown, obviously, and lift it on schedule. But in the last few days, we've seen 8 to 12 cases a day. All of those linked cases have been in isolation, but that doesn't mean the environment we're in is risk-free, as this morning's case illustrates. So we are relying on all Victorians to continue to follow the rules, to wear their masks and to observe all the gathering limits and other restrictions. And of course we're relying on them to check in, to get tested, and if eligible, of course, to get vaccinated at the earliest opportunity. Thank you. Kate Matson.
Thank you, Brett. Good morning. Yesterday, our teams cleared over 3,400 of the primary close contacts related to this outbreak, and that's great progress. That brings us to a total of more than 11,000 contacts cleared to date, and our number of active primary close contacts is well under 20,000. A quick reminder for those who have day 14 coming up. The key requirement that we need is a negative test on day 13. You'll be reminded of that via text message, and if we can't find that negative test result, you won't be able to be released. We have been seeing some cases through the numbers we've had in the last couple of days where we have found new cases through that day 13 test. If you don't want to get tested, you don't have to, but it does mean we will extend your quarantine period for 14 days so that we can protect the rest of Victoria and Victorians doing the right thing. So thank you again for those primary close contacts who have been sharing and protecting the rest of Victoria by isolating throughout their quarantine periods. If we have a negative day 13 test for you, we'll give you a call, make sure no symptoms have been developed, let you know that you'll be cleared, and then provide that written confirmation hopefully later that day or potentially shortly thereafter. That letter will state that the clearance is for you alone. Today and tomorrow are our biggest days of clearances since this outbreak started, and we're clearing thousands of people each day. So thank you again for your patience as we do that. Our teams are working extremely hard, the local public health units, the central teams, everyone, to ensure that we can release you as quickly and smoothly as possible. If you do have any issues or concerns as a primary close contact, you've got a phone number, please do call it and we'll get back to you as soon as we can. Our teams on the ground are also visiting close contacts, checking in, making sure they're okay. 830 household visits were conducted yesterday, and with the assistance of Victoria Police, which we're really grateful for, we're aiming to do 1,500 home visits today. Our teams at the airport yesterday, again, checking flights from the permit system that the Minister and Brett mentioned, and we checked over 800 people at the airport yesterday. So again, it's just that reminder, please, to get tested when you've got symptoms, use the QR codes, fill out your permits, and that'll help us to stay open as much as possible. I'll pass back to the Minister for questions.
Thanks, Kate. Thanks, Brett. So, any questions?
Can you explain why the risk is low for this Moonee Valley testing order?
Well, it's hard to say, Simon. It's literally in the last hour before we came to this meeting, the information came in. What I know is what I've shared, and the interviews and the investigation is underway as we speak. And as soon as we get more details, particularly what it might mean for both the workforce and people who may have been at that testing site, we'll have obviously more to say.
Any chance this could be a false positive, given there's no known link?
PCR tests are the gold standard when it comes to these issues, but we have seen them. So in terms of the normal risk that any test has, then yes, there is that chance, but we know that PCRs are the gold standard, and of course we'll go through the normal process of retesting, but at the same time we'll also work on the basis that it is a positive. We'll interview, we'll case manage, and we'll look at all the implications that it might mean for that Moonee Valley testing site.
Brett, did this change your thinking at all? Are you still confident with where we're at right now in terms of rules?
Oh, it's obviously a concern, but we are in early minutes, if not hours, of understanding exactly what's happened, where it might have been acquired at a testing site. Obviously, that's a point we'll look at in terms of how he might have acquired it, but we have to go through that process of interviewing, understand where he's been whilst potentially infectious, and then really work out what the links might be.
What's the testing regime for people who work
Oh, they'd be required to test whenever symptomatic, but there's no surveillance testing that I'm aware of. But the vaccination's also offered to all of those staff. No, early days. We haven't got the interview completed yet.
Do we know what LGA
Do you know how many
those
of his
persons from?
contacts are, do you know exactly how many people are in isolation, how many of the staff?
No, it'll be everyone who worked on either of those two shifts with him. So there'll be a couple of dozen at least, I think.
Which testing place was it specifically?
So it's the Moonee Valley testing site. Yes.
And what's your initial advice to people who went and got tested at that site for those 2 days?
Well, obviously, as we would say for every Victorian, if you're symptomatic, please go and get tested, isolate until you get a negative result. But as the Minister said, the risk to individuals coming through in their cars is extremely low, really. But if you've wound down your window to speak to a traffic controller at that site, that might put you at a slightly greater risk. So I think it's more about where he's acquired it from rather than the risk to those coming through, because most people would drive through without winding their window down until they're getting tested. But for everyone who's symptomatic, obviously just to isolate and get tested and await a result.
Do we know what LGA he's from?
No.
Are we assuming he bought it from somebody who went through the testing?
No, we make no assumptions whatsoever. Obviously, we'll look through to see whether anyone who's subsequently tested positive has gone through that testing site, but we have to do all of the investigations as to where he might have acquired it.
And what are the PPE requirements for traffic controllers?
So there's a tier 2 PPE, a mask like you're wearing, Nick. So it'll be standard for those non-direct interactions. All other testing staff wear a higher tier of PPE, but
He's basically just worn a mask.
he's worn a mask, yes.
Will this change your surveillance testing recommendation going forward? Should they be tested like?
Oh, we'd review everything about this, but again, very early days in terms of understanding exactly what's happened. But as for any critical incident, if you like, we would go through a rigorous process of understanding what's happened and what it might inform.
We've had days of cases majority in isolation, so how does this now change things moving forward?
Well, as I say, we just need to see what has occurred here. Overwhelmingly, we've had people in isolation the last 3 days in full before this case. That's all terrific news. But, as we said yesterday, it's not over. There will be ongoing risks and there'll be ongoing potential for incursion into Victoria. So it is not like any of us need to let our guard down with respect to all of the things that we know we need to do.
Just on rapid antigen tests, that's something that New South Wales is looking at introducing. I understand they have more efficacy in situations where you've got large numbers of cases, but is it something that Victoria is looking at? Is that something we could do in the future?
Yeah, we've looked at it right through. Again, very context specific. If you've got low or no coronavirus cases and you're doing 100,000 rapid antigen tests, you'll probably ping a few positives and they'll all be false positives because you've got no coronavirus. If you've got 100,000 people and a good number of them, tens or more, have COVID, and you use that rapid antigen test, you'll pick up, maybe the majority of them, but you'll miss some, and you need to be in a situation where the benefit of getting that result, within 10 or 20 minutes outweighs missing those few. You don't want false reassurance. You still direct people to get PCR testing, and when you've got a PCR system like we have in Victoria with results, most of them the same day, many within 8 hours, you have to look at what the advantages might be. But with a higher load of coronavirus, with the potential for essential workers or others to be screened at a kind of point of entry, then it might come into play. So we're looking at it. There are some research projects that we've done, and we continue to keep an open mind about them.
And have you got an update on vaccination rates for the 199 odd cases we've had in the last 2 community outbreaks?
We can come back to you with that. Look, in general, the vaccination rates for our cases has been lower than you would expect for the equivalent age groups. That might relate to the demographic of people who are passing on infection, but it might also be that the effect of one or more vaccines in protecting people. So it does in general have a look about it that people who've had at least one vaccine are not so represented in our case numbers. That's a good sign.
Given your thought is a large risk in How soon do you think it can be that people can have people in their homes? Some people say you can have people tackling each other but you can't have someone around. Are you comfortable with that position?
So we'll review, as we've said all along, on a day-by-day basis, but at the moment these settings are for a couple of weeks. We're not saying that you can't see loved ones or family, but we are saying please see them outdoors, because indoors is that risk setting, and when you multiply it by a couple of million homes across Victoria, that's a substantial risk increase to have that allowance at this point in time.
Sport where there's no mask.
Yeah, sport is not 2 million households. Sport will happen with hundreds of people, understand that, but it is outdoors by and large, and it doesn't have that multiplier effect of many millions of people coming together.
Just on that, why is there such a disparity in numbers on that? I mean, last time we were able to have a couple of people in the home. Why is it now no visitors in the home and you've really opened up for hospitality and other sectors? Could you explain?
Look, it really is where we see transmission occurring, and obviously with the outbreak that we've just had, we saw it in sporting arenas, restaurants and some workplaces and schools, but that was really an indication of how it was introduced in those settings. If it had been let run, all of the further transmission would have occurred in households. We've stopped that transmission in households by identifying quarantining people very early on. We're now seeing the transmission in households for primary and secondary close contacts because people are deciding to quarantine with family or have to quarantine with their household members. It's a super risk setting for those individuals who are positive to pass on to others in the house.
Brett, is inter-school sport able to go ahead?
No, not at this stage. So it's community sport.
Why is that?
Well, look, it does mean that you've got events occurring across the state potentially. We are opening up to community sport with pretty generous numbers because that's a way to contain it and to review and move stepwise. We are not opening to the kind of events in the same way that we haven't got large sporting events occurring.
But these are schools that are obviously already operating.
Yep.
They can't operate like a community sporting match.
So school sport can occur, but it's got to fall within the community sport settings.
Right. So like a carnival or like a major event can't go ahead.
No.
A school can verse another school in football.
Look, I can come back to you with the legal wording of our directions with respect to that.
Are there current rules for people that
I'll come to you shortly.
live alone? Like it's not an intimate partner situation, but if you live solo, can you still have one person around and get a bubble situation?
You can. No, you can have a single social bubble. Yeah. Sorry.
Music teachers can bring the students to their homes?
I'll come back to you on that one as well.
How long was the infectious period for this latest case, and are you expecting many exposure sites as a result?
So we really don't know. We have to go through the interview with him. But he's obviously tested very quickly after becoming symptomatic, and we've got the result straight afterwards. So there should only be that day of having symptoms and the 2 days prior that we always include as potentially infectious period. So there's 3 days to investigate for how he's been out and about.
What's their age profile?
I don't have that information, sorry.
He does.
Sorry?
It's a man.
Yes. A young man, I believe.
What are your thoughts on the idea of giving more allowances in terms of what you can do and restrictions for people who are vaccinated, whether it's now or in the kind of short term before we get that widespread vaccination?
Look, I guess I've been asked this question many times. I keep saying the same thing, and I do accept that you're at lower risk as a fully vaccinated individual in particular. I think that should mean that there's consideration of either greater movements or greater involvement in certain things, whether they're events or certain settings. I'm very strongly in favour of there being a national standard for that, so that there isn't an ongoing and highly charged debate around the disparity between jurisdictions or without there being some kind of national standard setting in that regard, including how you validate it, what is regarded as fully vaccinated, which vaccines it might apply to, whether people who've been vaccinated overseas but finished their course here might be included, whether it applies to all of those intervals between first and second dose, and so on and so forth. They're really critical things from the point of view of equity and natural justice for people who are included in freer movement or freer involvement in events. So yes, I think the principle sounds pretty good, but there is a real need to make sure that we've got a kind of consistency of approaches across the country.
Is there a role for AHPPC in working on what those national standards should be, and then maybe making those recommendations to National Cabinet and the federal government?
Yeah, I think so. We haven't had that request from National Cabinet. It would be a combination of my colleagues and myself through AHPPC, but also ATAGI as an immunisation expert group around what it means to be fully vaccinated.
Do you think it would be fairly done before vaccinations are opened up to everybody? Like, for example, if you did it now, somebody could have more freedoms by virtue of the fact they're 40 and over, whereas people who are in their 20s and 30s can't go and get the recommended vaccine.
Yeah, I think it brings in some of those issues of inequity. If there's an entire large age cohort who haven't yet had an opportunity to be vaccinated, it becomes a tricky thing to say that others who've had that opportunity have got entitlements to be in certain settings or events or have movements. So that's a tricky consideration.
The Victorian Transport Association and a lot of people in the border towns are concerned about the number of truckies that are coming into the state without either being checked or without having a permit. Is there any plan to tighten up further, particularly obviously given the history?
I'll throw the Minister because I know he's across this, but my understanding is there aren't huge gaps in that space.
Thanks, Nick. So we saw those reports this morning, and I sought a quick briefing before we came down. So it's a national system, and it's applied by each of the state jurisdictions on a consistent basis. And I do note that the Commonwealth have put this issue on the agenda for National Cabinet this week, which we welcome. There is, of course, a difference between the number of truck movements, which can come and go and do come and go on a regular basis, as opposed to the number of permits. One person with a permit can, quite rightly, come and go on a number of occasions. So that's partly the explanation for the discrepancy that was reported this morning. The other potential contributing factor is the large number of movements that occur within the border bubble by freight drivers within the confines of the border bubble. So there is genuine reasons as to why the figures don't perfectly match. Having said all that, of course, the recent tightening of the freight border arrangements nationally with increased testing, we don't shy away from. What we do commit to, obviously, is working through with the freight industry, as they have shown throughout the last 18 months, the best way in which that critical work can continue. Our vital logistical operations continue to keep us all fed and keep the wheels literally rolling. How that works in the best possible way, we're always looking at how we can improve that.
Do you see it as a problem, though, as it is?
No, we don't see it as a big problem. Clearly, having tightened it up in recent times, we did identify problems, but we're happy to sit down with the industry and establish if in fact there are particular ways in which we can improve things even more.
But the Victorian Transport Association has come out and said that drivers aren't getting tested, and there's over 15,000 crossing that border. So how much?
That's right, 15,000 crossing the border with more than 9,000 permits. So people come and go within the one permit quite regularly. So that partly explains, largely explains that figure. But of course, we'll sit down with the national transport organisations and their state equivalents, like we always do, to work through how to do things better.
The transport industry, sorry, just on that, they've also called for rapid testing. I know this is a discussion point that's been brought up previously. Would you consider that for this industry?
Of course. We think that any contribution to keeping people tested is worth looking at. But as the Chief Health Officer indicated, in the Victorian circumstance at least, with a low-risk environment, comparatively low-risk environment, we'd want to make sure that we don't miss any, and the relative benefits of the rapid antigen testing might well be outweighed by the risk of false negatives coming through. So in that regard, we're always open for discussions, but we think the current system works pretty well. We understand that requiring the freight industry to test more now is an imposition on them, but we think it's a proportionate imposition given particularly the increase of the virus's movement in New South Wales.
What's your recommendation though? How can we continue for essential workers to operate under a safe regime and not incur another outbreak? What do you think? What would work best?
Eternal vigilance. What we need is always to look at the evidence, always to look at the chains of transmission that continue to present in new ways, and making sure that our vital infrastructure of food and distribution centres and logistics is kept moving, but to do so in the safest possible way. And all of those sectors have been excellent partners in that shared challenge to date.
I understand police, have been using number plate recognition technology rather than setting up roadblocks on the borders. Are they going through and matching those number plates, and are they going through with all of the freight number plates and then matching them with the permits that have been issued? Is that something they're doing?
Well, they are actually also having stoppage areas with their mobile buses and other arrangements, so they're not just relying on technology. I know that technology is linked to national and interstate databases, but whether it's linked to precisely picking up the freight registrations, I would expect it to do so, but let me double check and make sure that we have given that right information.
Is that something they could do just to make sure that everyone who is travelling over that border has a permit?
I'm sure if it's technologically capable of being done, that'd be something that we'd look at. I don't have an answer for you, but I'll get one for you.
Just one quickly for Kate on contact tracing.
Go for your life.
Just on the Richmond Icon site, which was a site on the 15th and 16th, I've had people in touch with me who were there on the 16th, had checked in using the QR code and then didn't receive a text until last night saying that they were a Tier 1 close contact and should have been quarantining for the past 12 days. Because they hadn't had that text, they hadn't realised, and they were out in the community for the past 12 days. Why is that happening? And also the text message initially referred to the 18th, and then 3 hours later they received a text message saying that actually it was about the 16th and that the first message had been wrong.
That particular issue hasn't come across my desk, Rachel, but happy to look into it. Certainly we're very happy that everyone who follows the Exposure Site website and acts on the advice there, as well as any direct contact from the department, we thank them for doing that. That shows the importance of the QR code system, and we're more than willing to look into that specifically.
And just on people who will be on day 14 of waiting to get out of quarantine, if they've received their negative results and they've reached the end of day 14 and they still haven't heard from you guys, what should they do?
In some instances, we may not have correct contact details. We work that through. A number of those have come across my desk, thanks to our friends in the media over the past couple of days. We look into each individual case and make sure we contact those people and make sure that everything is okay. We double check the systems for negative test data. Sometimes, for instance, what's been put in by the pathology lab may not exactly match the records we have, and we do have a manual process in place to make sure we capture everyone as soon as we possibly can. I'm really pleased we were able to clear 3,400 people yesterday. Over 11,000 cleared to date is really excellent progress.
Let's ask Ms. Foley a question unless you've got one. Sure. Question. Just, I know we covered off with Brett before. Can I get your thoughts? The live entertainment industry is keen for vaccine passports as a way of accessing events for patrons to be able to prove they've been vaccinated to go in. What's government's thoughts on that?
Pretty much as the Chief Health Officer indicated, if we're going to have, as I think ultimately we will, need to have a system of verifiable processes that give venue operators, cultural centres, sporting clubs, the AFL, you name it, the certainty that their audiences and their participants have been appropriately vaccinated and form a lesser risk, then that's something that I think all Victorians would welcome. What we need, clearly, is a nationally consistent approach to that, all of which is predicated on the basis that we've got pretty high levels of vaccination. And at the moment, I think we're bumping around 13 to 14% of the Victorian population fully vaccinated. I think we're about 35, 36% a single dose. Obviously, some age groups are overrepresented in that because of risk factors, and some groups are underrepresented, particularly those younger parts of our community who get out more, who go to gigs, who want to get to live venues, who go more to arts and cultural events, who get out to sporting events. Until such time as we get those numbers up, I think that gives us a good opportunity to have that national conversation about what does a framework along the lines that you talk about and that the Chief Health Officer touched on, what does that look like, how does that work, and how can we make sure that it's there ready to go when the circumstances land.
But the live theatre and live events industry, they can't wait until we're in a position where we can get a vaccine.
I have nothing but sympathy for the position of our live events and theatre and cultural groups in particular, having been first into shutdown and last out. That is a really significant issue for those performers, those people who require whose income and livelihood depends on it, let alone the millions of Victorians who are itching for those facilities to reopen. The truth of the matter, sadly, is until the vaccines start to ramp up again in another 4 to 6 weeks, we can only distribute what's provided to us.
Has the Moody Valley testing clinic, the one at the racecourse, been closed permanently?
I don't know about permanently, but it's certainly closed at the moment, and we'll go through all the processes of checking, of testing, of cleaning, of all those arrangements, understanding that the person concerned was right at the start of that process as a traffic controller, and it's a pretty big site, so you know, we don't know if he acquired it there, but out of abundance of caution, we're certainly working on the basis that it's a possibility. So everyone's being quarantined, everyone will be tested, the site will be cleaned, and then we'll make a judgment once we know some more information as to the likely source of acquisition as to what we'll do with that site.
Roughly how many staff are there?
I don't know, but we can get to that.
Do you know whether they're in quarantine?
I beg your pardon?
Definitely, or for 14 days?
Well, let's make a judgment, but my understanding is that the normal risk assessments will be made, but if they're defined as primary close contacts, which I'm pretty sure they will be, then it will be 14 days.
Just one last question to wrap up on that case. We've been tracking exceptionally well until now. World Health Organization has previously stated the lockdown should be used as a last resort. So what happens if from this cases emerge again? How do we strike a balance between managing cases and shutting down the state?
It's way too early to make any calls as to what the implications of this particular case might be. Once we've got the evidence, once we've got all the material as to what this particular person's circumstances are and likely sources of acquisition, we'll have more to say. I think it's a bit early to be jumping to what it might lead to just yet. We will treat every set of circumstances on its merits and act accordingly, as I think Victorians would expect us to. Looks like we're about to have a changing of the shifts. So, any other questions for us? Thank you, everyone.
I'm doing this one too.
Hey, I normally do that 2 hours, and there's no sound. At least we don't have to do this. That's good.
No, sorry.
God, I think you got a lot of the barrel.
staying, Richard? Or?
Cool.